Welcome, Mohan. Welcome to this platform. You have passed FMG 2023 in first attempt. That's a huge achievement. People
Yes.
are not passing this exam even after fifth, sixth attempt, and you have done it in first attempt. I just wanted to discuss with you and draw some useful conclusions for your juniors because they are now preparing for. Some of them are preparing for FMG. Most of them are preparing for an upcoming next exam. So how are you feeling? What was your score?
Sir, myself, Mohan Raj, a graduate of Four State University. I scored 157 in my first attempt in Jan 2023. My strategy, I started with my basics in my med school, sir. We started through Bright EduWorld. Then going on with the basics, I was stuck to first year subjects. That was my strong subjects like physio, biochem. These three were the strong subjects of me. And uh, on the day of result, it was unexpected. The result was on 10th February. The result was supposed to be on 10th February, but it was preponed on February 3rd. And I was really, and when checking itself, I had a great anxiety more than I was writing exam. Literally, hands were shaken, and I can't handle that anxiety. But as soon as I checked that I'm passed, it was I had no words to express. Like after my 11th, 12th, and after 6 years of journey in foreign country, and after that 6 months of preparation, it was worth enough.
Wonderful, wonderful. That's great. So you are happy, and it's great that you are sharing your happiness
Yes,
with
sir.
us, and we
No
are also
words
happy
to
that our.
express.
Sorry, I didn't get.
Sir,
You said something.
nothing, sir, nothing.
Okay, okay. So, what was your study strategy? How did you study?
Sir, I studied from my fourth year, sir. I started my preparation from my fourth year. It was on COVID time, 2020. The whole world was in COVID. So it was on lockdown. So I started with Bright World anatomy videos. I started with the anatomy videos of our website, and I studied anatomy, biochem, and patho in our Bright World. The educators are well enough. They trained me good, and biochem ma'am, what she taught, it directly came in the exam. Like those contents of carbohydrates metabolism, what she taught, what all the clues she gave, it directly reflected onto the paper. Then I started with my fourth year. I started with my basics because FMG exam is all around the basics. I think so. It was beating about the same bush. So I was well trained in my basics, all the pre and the paraclinical subjects. And gradually, before graduation on 2022, I was able to complete only around 6 to 7 subjects. But those subjects were all physio, patho, biochem, pharma, micro, and a bit of medicine. These all subjects I covered. And in that meantime of 6 months, I covered all the remaining subjects, and I gave around four revisions for medicine, PSM, obstetrics, gynecology, and surgery. So I did four revision for these four big subjects, and for the remaining subjects, I did around two revisions. And I integrated patho and pharma from my med school itself. I used to integrate both and learn because pathology, what we learn now, that if we learn iron deficiency, anemia, like those topics, it directly reflects under hematology topic in pharmacology. So if we integrate it, it will be very much easy to learn. Like the same way I integrated, I used to take a paper. In that, I will write a cardiovascular system, pathological features, and the stains, what all are included in one page. and I will turn next page and I will write all those pharmacological drugs, beta blockers, and those congestive heart failure drugs, arrhythmia, angina drugs, and I used to write all those in the opposite side. So while during revision, it will be easy for me to cover both patho and pharma in just around 3 to 4 hours. I used to write tiny notes. These tiny notes, this played a major role.
So can you please
And
elaborate what these tiny notes were about? How did you practice that?
yes, sir. The tiny notes, now. If in anatomy, we need to learn about triads. Triads are the most commonly asked questions also and the landmarks. In those anatomy, the tiny notes which I made are about triads. In patho and pharma and medicine, if it is a cardiac tamponade, like in which the X descent is seen, and in the congestive heart failure, what all the drugs we use in the commonly, and those side effects, I used to write it in a straight line, and I used to write it in a straight line in a short notes only, so that I could recall it. I won't write it in an elaborate manner as such in the Harrison's book, because it's big, large. So we need to shrink it and write all those essential points around in paper, like A wave, C wave, X wave, V and Y. What all these five waves stand for, and what are those pathological features. I used to write it only in 2 lines, so that I don't need to see that whole chart, and I don't need to read that fully again. And I 2 lines, I will finish those that chapter fully. And coming to the next, I will use to write next respiratory for asthma. Asthma, what are the classifications? I will write in just 2 lines. I will write, and what are the drugs contraindicated? The drugs which are used are not most commonly asked in the exam. The drugs which are contraindicated are the exception drugs are most commonly asked in exam. So I used to write those golden points, and I keep it for revision. And the golden points for patho are stains, and in systemic patho, you will get to know what are the main if you integrate patho and pharma. So my kind advice to juniors is that if you finish a topic, please take a small bit of paper and write what all those small contents you could summarize that and keep revising. These tiny notes play a very major role in preparation during the last month.
So these tiny notes you were writing in some notebook or some kind of small diary?
I was writing in small books, sir. Small notebooks only.
So you had maintained a small diary and you used to write these tiny notes while preparing. That's a good suggestion, of course. Great. And what kind of
Sir,
time
this
management?
was
How did you manage
very.
your time?
Sir, time management. Actually, what time we have, it won't be enough. Even if we get some more months for the exam, also, it won't be enough for us. We need to use it wisely. That's the main concept. In my preparation, I used to study around 15 to 16 hours a day, sir. Initially started with 10 to 11 hours. It gradually went around. I increased around 1 hour per 1 week, and it increased, sir. This was at the final stage of the examination. During the last 4 weeks, that is the last month, I slept 4 to 5 hours only. But during the last week, I slept well.
Okay, great, great, great. Thank you, Mohan. Thank you. Anything else you want to share?
Yes, sir. Just a bit of alone for my juniors. Start your preparation as soon as possible. I just want to implicate only these three features, sir. First, choose your source, whether it might be online or offline. Just choose the source, juniors. And revision is the most important. Do more revisions as soon as possible. And the third thing is MCQs. do as much as MCQs as you can, and trust Bright EduWorld. They are coming with an app platform as of now. So the educators are well enough to train for FMG exam. So trust them. And I did ENT questions and ophthalmology questions from the Bright EduWorld. The ENT questions which were discussed in Bright EduWorld during the last time were directly reflected. That tumor staging were directly reflected, sir. I just wanted to say that the tumor
Great, great.
markers, tumor staging which came directly reflected, sir.
Okay, thank you. Thank you so much, Mohan, for connecting with us. And it was a huge pleasure to talk with you. Thank you so much. All the best for your future endeavors.
Thank you.
Thank you.
Thank you. Sir. Thank you, sir.
Yeah. Uh,